Last week we discussed the thyroid and how gut dysfunction, especially imbalanced microbes in the gut and imbalanced microbiome, can promote thyroid autoimmunity, specifically Graves' disease. So if you missed that video, I recommend you check it out on my YouTube channel. This week we want to talk about how the gut microbiome plays into risk for Parkinson's disease, which isn't often categorized as an autoimmune disease because it's typically labeled a neurodegenerative disease, but it in fact is an autoimmune disease. And if you'd like to learn more about that, chapter 1 of my best-selling book, The Autoimmune Answer, is all about Parkinson's disease and its status as an autoimmune disease. And what we're going to cover today helps reinforce the fact that it's an autoimmune disease, and we can return to that information as we go. So the studies today are both from 2020, and they're both looking at the gut microbiome and how it plays a role in Parkinson's disease risk and development from two different angles. It's important to realize that you can have GI issues and then problems as a result of GI issues from too few probiotics. Okay, so you could have an insufficiency dysbiosis, which dysbiosis is a nerdy term for imbalance, okay, and imbalance in microbes. So most people read blogs that talk about leaky gut and then talk about gut dysbiosis, and most of those blogs are talking about dysbiosis in the term of a predominantly pathogenic dysbiosis where the imbalance is because of too many bad bugs. Well, you can have an insufficiency dysbiosis, which is not too many bad bugs, but too few good bugs. And so the research we look at today, one study is going to look at insufficiency dysbiosis or too few good bugs as a driver of Parkinson's disease, and the other study is going to look at dysbiosis as most people are used to it, or too many bad bugs as a driver of Parkinson's disease. So let's dive into that first study. And this study is published in the journal Nutrition, and the title is Neuroprotective Effects Associated with Immune Modulation by Selected Lactic Acid Bacteria in a Parkinson's Disease Model. And so what these researchers want to look at is essentially Parkinson's disease, like we said, is a neurodegenerative process, and key to it is neuroinflammation and B vitamin deficiencies. So in my book and on various videos I've made in the past, I discuss how homocysteine is a significant and common driver of neurodegeneration, and homocysteine is an oxidative stress marker. It metaphorically is driving rust or increased aging or degeneration in the brain. And for those of you who frequent the health blogs, you've probably read about the process called methylation and heard about the gene or the allele MTHFR. Well, what all that is doing, methylation and proper function of the MTHFR allele promotes recycling of homocysteine. If you don't recycle homocysteine well, it builds up and you're driving oxidative stress and potentially neurodegeneration. Well, for the methylation process to work properly, the MTHFR gene and other genes involved, the MTRR, the CBS, these genes require folate, B12, and B6 sufficiency, respectively. So if you're deficient in one or more of those B vitamins, you can be methylating poorly, leading to homocysteine buildup and neurodegeneration. And then that neurodegeneration drives the inflammatory process, and here we go. So those are two possible contributing factors to Parkinson's, and the most well-known, two of the most well-known. And so Parkinson's disease is neurodegeneration that largely is viewed as a motor disorder. So as your brain degenerates, you get slower, you get that resting tremor. They may get masked faces, which means the face kind of goes blank. They might start drooling. They're slower to move. They're slower to speak. They're slower to think. So these are the typical neurologic symptoms of Parkinson's disease. and you know, posture and slow movement are what most people think of. But in fact, Parkinson's disease is a systemic disease, and 10 years before you ever have the first tremor, oftentimes you have constipation. Constipation is called a hairbringer for Parkinson's, or a predictor of Parkinson's. Oftentimes you also have right shoulder pain. And why right shoulder? Well, the right arm, right side of the body feeds into the left cortex, or the left brain, and Parkinson's disease often impacts left brain. It can impact both sides, but oftentimes left brain is more impacted. So, you know, there's these various signs that occur a decade or more before the first tremor, showing that it's systemic constipation, bloating, things of that nature. Well, one of the things that drives constipation and bloating and the GI related systemic symptoms is gut infection. And Parkinson's has also been called a gut-brain axis disorder, which means oftentimes what they're finding is that it can start with an infection in the gut or dysbiosis in the gut, and the microbes travel up the vagus nerve into the brain and drive infection and neuroinflammation in the brain. You can also have the infection start in the nose, in the olfactory nuclei, and travel from the nose nerves into the brain that way. So this study is looking at whether we can take Parkinson's disease patients and give them probiotics that help reduce the inflammation that's part of the disease and replete the B vitamin deficiencies that are part of the disease, and create improvements in motor skills and reduction in inflammation. So the study finds that, in fact, you can do that. What they did was they took Parkinson's patients and they took 3 different strains of probiotic. They took Lactobacillus plantarum, which is a riboflavin producer of vitamin B2. They took Streptococcus thermophilus, 2 different strains. One is an immune modulating strain or an anti-inflammatory strain. The other promotes folate production, or vitamin B9, which is key for that MTHFR gene in the methylation process. And by giving these probiotics singular or in combination, they created change in the clinical outcomes of Parkinson's. Specifically, combining all 3 strains together led to decreased inflammation in the brain and increased anti-inflammatory response, as well as improved motor symptoms or improved motor skills compared to those that did not get the bacteria. So this was in a mouse model, but we always, start studies on animals, or we should always start studies on animals first, get proof of concept, and then move into humans. And so the authors concluded that using lactic acid bacteria mixture to improve motor behavior and neuroinflammation in Parkinson's disease could be used as an adjunctive treatment for Parkinson's. So correcting an insufficiency dysbiosis may promote improvement in Parkinson's. And why wouldn't we do that? What's the negative outcome going to be? You're not helped. That's the worst that's going to happen, right? And typical Parkinson's disease treatment in conventional medicine is the drug levodopa. So they basically address dopamine and that's it. And no wonder they don't get the results they want, because dopamine is the effect, lack of dopamine is the effect of the disease process, not necessarily the cause. And also, I discuss in my book that levodopa, the main drug given for Parkinson's disease, actually increases homocysteine levels. So the drug used to address it actually worsens the process that drives the disease. So let's do better. Let's address a systemic disease with systemic strategies. And one of those would be using probiotics in the subset of Parkinson's disease patients that have insufficient probiotics. The next study was published in the International Journal of Biological Sciences. And this one's really interesting because it's looking at at dysbiosis from the pathogenic or potentially pathogenic side of things. And these authors wanted to discover whether or not they had a hypothesis that mixed microbial infections drive Parkinson's. And they said, let's try and prove that by seeing if we can find presence of mixed microbial infection in the brain. So they took 6 Parkinson's disease patients, post-mortem. They took their brains and they used PCR testing to look for different fungal species and different bacterial species, look for the presence of it. And they ended up finding multiple fungal species in each brain that they tested and multiple bacterial species in each brain that they tested. And there were different species in different brain locations. The most common fungal species they identified were Botrytis, Candida, which, Candida, most people, when they hear yeast infection, they think Candida. Yeast is a general name like fungus. The specific form of yeast could be Candida or Fusarium or Malassezia, So those 4 were the fungal species they found. The most common bacteria they found were strep and Pseudomonas. And Pseudomonas is found in other central nervous system autoimmunity, is associated with other CNS autoimmune disorders such as multiple sclerosis. So the authors say, we noted similarities and differences between the microbiota present in the brain of patients with Parkinson's disease and that in other neurodegenerative diseases. So they've provided compelling evidence of a polymicrobial infection in the disease process of Parkinson's. And they said, when looking at other neurodegenerative diseases, we found similarities and differences there. So we found microbes in other brains of neurodegenerative patients. So these results provide the basis for effective treatment of this disease using already approved and safe antimicrobial therapeutics. So look at that. Parkinson's disease, antibiotics could potentially help. Or what if we used antimicrobial herbs, right? Antibiotic herbs instead of pharmacology, and introducing potential toxins to the patient, we could potentially instead use herbal antimicrobials to get the antimicrobial result we want and promote improvement in Parkinson's patients. So I hope this excites you if you're watching this and you want to prevent Parkinson's, or someone that has Parkinson's and want to help optimize the quality of life and outcomes in their case. Because here are 2 mechanisms that you could use if they're present in that person. If that person's lacking a healthy microbiome, you could provide probiotics, and specific to Parkinson's, that 1 Lactobacillus plantarum strain and the 2 Streptococcus thermophilus strains. And if the person has dysbiosis from a bad bug standpoint, you could use natural antimicrobials to oppose fungal species, to oppose bacterial species. And then, of course, you could support optimal anti-infectious immune defenses. So you get the 1-2 punch of killing and then improving surveillance and clearance. So again, when you read health blogs and you wonder, why does everything always go back to the gut? Why does everything go back to the gut? Well, 1, because up to 80% of the immune system is in the gut. So if something's wrong with the gut, the immune system is activated. And then if that becomes chronic, that can lead to issues. 2, if the gut's inflamed for a long time, you can become systemically inflamed and then neuroinflamed. So gut inflammation can lead to neuroinflammation via gut-brain axis mechanisms. And 3, you've got the gut microbiome, which has been shown to not be just strictly contained in the gut, but can travel systemically to other locations and have impacts, both positive and negative. So always consider the health of the gut and the impact on the immune system from a healthy or unhealthy gut on the case that's in front of you. Let's open this up for questions or comments.
What they're finding, this is obviously through an autopsy, it's in the brain, but it's nowhere else.
No, it's in the brain because it came from somewhere else.
Okay.
But what they wanted to prove was that there's polymicrobial infection in the brain. So if we dig into the text here, it says a plausible mechanism to explain inflammation and the clinical symptoms in these patients is the presence of systemic microbial infection. So accordingly, this study provides extensive evidence for existence of mixed microbial infections in the central nervous system, not just the body, but it actually makes it into the brain. So that's what they wanted to prove, and that's what they did. So down there, we show compelling evidence of polymicrobial infections in the brain, and essentially it's coming from elsewhere. Most commonly, it's coming from the gut and then jumping in either systemic circulation because of bacterial translocation from the gut into the bloodstream and traveling that way, or there's gut-brain axis mechanisms via the vagus nerve, or there's the olfactory nerves, which are your nose, the smelling nerves. You can travel straight into the brain along those two pathways. So there's multiple ways by which they could enter. This study was looking at how much of it is actually entering. Can we find evidence that that's happening on a large scale?